SCM. And you'll be able to slide your finger behind it. Relax, put your head back down. Okay. So turn slightly 45, lift your head up, that engages SCM. You know it attaches to the Mastoid Process, okay? So you can also track down from there. And the technique is that you want to, same idea as the trapezius, spread the skin over it, okay? Because you don't really want the skin and fat, you just want the muscle. So do the best you can to get only muscle and as little skin and fatty tissue as possible. So when in doubt, have them lift the head up, okay? So that it accentuates it, like okay, relax. Then you can be able to run your fingers behind it, okay? So you have a few options. You can needle it on the anterior side of the SCM or posterior side of the SCM. Take some moment to kind of depress it so you can appreciate its girth, its diameter, okay? Know that because a bunch of superficial nerves running out from behind it, as you release SCM, sometimes they'll say, oh, I feel a zing to my throat, a zing to my clavicle, a zing back to my head. You can also spray the skin with the holding hand this way and brace the muscle. Bracing is also a technique to improve your odds of success, applying pressure there. So in this instance here, I'm going to try a posterior anterior approach. So if you get too close to the attachment to the mastoid, it's hard to jump. Okay, so mid-distance or proximal 1/3 is a good place. When you get too inferior, when the muscle becomes tendinous to attach to the bones, it's hard to put a needle in the tendon part. So we want to stay within the nice fleshy muscle belly part. At the other end, when it attaches, it becomes very tendinous. It's harder to get the jumps. Okay, so aim kind of middle point or proximal or superior 1/3-ish. So you're going to try the bracing technique. Okay, and this way I'm trying a posterior anterior approach. And what I'm trying to do is I'm trying to get a twitching response. And sometimes what happens, you see it dancing. And this is done previously by palpation first, okay? Identifying which part is the most tender and sensitive. You're searching for asha, basically. Okay? Getting the jump. And then usually I'll do 2 needles. The next one I'll demonstrate an anterior posterior approach. So you roll across the anterior border. It's kind of like doing the masseter. You find the front and go back. It's that feeling of hooking the muscle from the front. And then you can needle posteriorly. Jump, 1 jump. 2 jump, okay? That's the idea. So I don't needle directly in because people feel a little scared.